So, hello students. In this session, we'll be studying the development of salivary glands and nasal and the oral cavities. So, our specific learning objectives are you should be able to describe the development of the salivary glands, then you should be able to describe the development of the nasal cavities and the oral cavities. So, before I start my class, I'll give you a brief account of what we have studied. So there were 5 facial prominences. So one was the frontonasal prominence of this. I'm making is a nasal prominence. This one's a nasal pit I'm making. The lateral nasal prominence I've made. This one is the median nasal prominence of the one side, median nasal prominence of another side. This one is a nasal pit and the lateral nasal prominence of the other side. These are the developing eyes, the optic cycles, extension of the forebrain, and in the midline over here, these are the mandibular prominences giving rise to the lower jaw and the lower lip along with the tongue. Then this is forming the caudal boundary of the stomodium. Then we have the maxillary prominence, which is started approaching towards each other, and they will be fusing with these lateral nasal processes along a furrow or a groove, which is a naso-optic groove. This is nothing but the ectodermal thickening. All these were having a core of mesenchyme and they were lined ectodermally. So now this one is the maxillary prominence, this one is the mandibular prominence. So at the junction of this maxillary and the mandibular prominence, to fuse, what happens? There should be dissolving of this epithelial seam. So now what happens at the junction of the fusion of this maxillary and the mandibular prominence, there appears an ectodermal furrow on both the sides. That is, there is firstly a thickening of the ectoderm, and later on it is submerged inside when the maxillary and the mandibular prominence fuse, and finally it will be canalized and it will form a duct. So this ectodermal furrow at the junction of the maxillary and the mandibular prominence, this ectodermal furrow is having a ventral part and a dorsal part. This dorsal component will expand and it will form the parotid gland, whereas this ventral component, it will form the Stensen's duct. And the junction of the maxillary and the mandibular prominence, where this duct is opening, will mark the angle of the oral fissure, the primitive oral cavity. So, likewise, similarly, at the junction of the pharyngeal arches, that is at the base of the tongue and the mandibular prominences, there will be appearance of the endodermal furrows on both the sides of the tongue, like this. And this will give rise to the submandibular and the sublingual glands, respectively. So the submandibular and sublingual glands, they are endodermal in origin, since the pharyngeal part of the mouth, of the tongue, it is lined by endoderm, and the parotid gland, it is said to be ectodermal in origin. So I will now start with my class. So during the 6th week and the 7th week, there is a branching of the solid epithelial buds of the from the primordial oral cavity. So this one is the primordial oral cavity, that is the stomodium. So from there is branching of the solid epithelial buds. So it is ectodermally lined at the junction of mandibular and mandibular and the maxillary prominences, and it is endodermally lined at the junction or between the tongue and the pharyngeal arches, the junction of the mandibular prominence. So firstly, how the parotid gland is formed. So it develops like as a groove, like invagination of the ectoderm, which forms a crease between maxillary and the mandibular swellings during 6th week of intrauterine life. Now this groove differentiates into a tubular duct and it will sink into the underlying mesenchyme, which I have already explained you. So now this tube, you can see it is having a dorsal component which is lying close to the developing ear, and it has got a ventral component. So when the maxillary and the mandibular component, they will fuse, this duct will be submerged inside. Earlier it was lying outside the cheek, then it will go inside the cheek. So that is why it opens inside the cheek on the upper second molar. So this opening of the duct of the parotid gland, it represents the primitive oral fissure and primitive angle of the mouth. So similarly, there are endodermal invaginations in the floor of the oral cavity in paralingual sulci on either side of the tongue. So they will give rise to submandibular gland and the sublingual glands respectively. So sublingual and the submandibular glands, they are endodermal in origin, and parotid gland, it is ectodermal in origin. The ectodermal furrow formed at the junction of mandibular and maxillary prominence will give rise to parotid gland. It will have a dorsal component giving rise to the gland proper, and a ventral component giving rise to Stenson duct, whereas the endodermal furrows at the paralingual sulci in the floor of the mouth, they are endodermal in origin, so they will form sublingual and the submandibular glands. Now the formation of the nasal and the oral cavities. So what are the events which will be occurring in the development of the nasal cavity? So firstly, there will be a formation of nasal sac, then there will be a formation of nasal fin, then the formation of oronasal membrane, then the formation of the primitive posterior nasal apertures or the primitive coenes, then the formation of primary palate and the secondary palate, then the formation of nasal septum and the nasal conchae, and finally the formation of paranasal sinuses. So firstly, the first event to be discussed is the formation of nasal sac. Now this diagram, if you remember, this is the lateral view of the developing embryo at the 6th week. So the first depression is the nasal pit, then is the median nasal process, which is bounding this stomodium. This is the primitive oral cavity, and this one is the developing tongue. So at the end of 6th week, the medial nasal process, it will start merging with the opposite side. So now it has become bigger in size. In the second diagram, you can make out the difference. So now it is formed the intermaxillary process, and the two nasal pits also, they will fuse. Their dorsal walls will fuse and they will form a single nasal sac, which is lined by ectoderm. So over here, you can see the difference in the first and the second diagram. Here is a nasal pit. Here it is a nasal sac, which is formed by the fusion of the two nasal pits. And this one is the intermaxillary process formed by the fusion of the two medial nasal process. Then what happens from the end of the 6th week and the beginning of the 7th week? There is thickening of the floor and the posterior wall of this nasal sac. So this thickening is like a plate, so it is known as nasal fin. So this nasal fin, it separates the primitive oral cavity with the nasal cavity. Then what happens? Small vacuoles, they will start appearing in this nasal fin. So when the vacuoles, they will develop in the nasal fin, they will start merging with each other, and finally these vacuoles will be taken up in these nasal sac, so thereby expanding our nasal cavity. And this thinned out nasal fin is now known as oronasal membrane, since it is separating the primitive nasal cavity and the oral cavity. Now this over here, you can see this is the developing tongue, which is start receding backwards. The intermaxillary component over here, you can see the difference in the two figure. The intermaxillary component is now start descending backwards. It is giving its starts giving its posterior extension. So now it will form a primary palate over here. So now is the formation of the primitive choana and the primary palate. Now finally what happens, this is the oronasal membrane, which was formed out by the thinning of the nasal fin. So finally it will rupture, and thus it will lead to a connection of the nasal cavity with the primitive oral cavity. So this aperture which is formed is known as primitive choana or the primitive nasal aperture. Now, the floor of the nasal cavity at this stage is formed by a posterior extension of this intermaxillary process, which is known as primary palate. So, after the rupture of oral nasal membrane, this intermaxillary process is now called as primary palate, which is the only division between the primitive nasal cavity and the primitive oral cavity. So, now is the formation of the secondary palate. So over here, this is the frontal section of the embryo. So this one is the nasal septum, which is derived from the frontonasal prominence and the mesenchymal proliferation of the median nasal process. Both will contribute to the formation of nasal septum. This one is the developing tongue. Ahead will be the intermaxillary process or the primary palate, and on the side are the extensions from the inner wall of the maxillary prominences, that is the palatine shells. So there are four events which contribute to the formation of secondary palate. Is firstly the growth of the palatine shells or the palatal shells from the inner wall of the maxillary prominence. So since it is coming from the maxillary prominence, so palate, the main contribution is by the maxillary prominences. Secondly, there is over here you can see there is elevation of these palatine shelves. Since here is the developing tongue, so to provide space, it will elevate, it will become horizontal and parallel to this developing tongue. And similarly, with the development of the mandibular arch, this tongue will also descend downwards and it will migrate somewhat posteriorly. Then the fusion starts between the premaxillary or the primary palate and these palatine shells in a Y-shaped manner. And finally, for the fusion to occur, there is removal of the epithelial seam at the site of fusion. That is the epithelial lining. It will undergo a programmed cell death. Cell death is when it is in a programmed manner, when it is planned by the cell itself, then it is known as apoptosis. So these are the four events which are occurring in the formation of secondary palate. So after the formation of the secondary palate, and this one is the approaching nasal septum, it will fuse with these intermaxillary process and the palatine shells. So finally, this will complete the formation of secondary palate and it will divide the nasal cavity from the oral cavity. Then is the formation of the nasal conchae. So how the nasal conchaes are formed? In the lateral wall of the nasal cavities, certain elevations are developed. So this will give rise to superior, middle and the inferior nasal conchae. Later on, the inferior nasal conchae will separate out and it will form an independent bone altogether. Then the formation of the nasal septum. So I've already told you the ectoderm and the mesoderm of the frontonasal process and the median nasal prominence. It will proliferate in the midline. It will contribute to the formation of nasal septum. So both the frontonasal prominence and the medial nasal prominence is contributing to the nasal septum. Then it will grow downwards towards the meeting lateral palatine process and the premaxilla or the intermaxillary segment. And finally, it will divide the nasal cavity into two parts, as well as it will divide the nasal cavity from the oral cavity. So over here, you can see this is, we are watching the floor of the mouth from below. The tongue and the mandibular prominences have been removed. So these are the palatine shelves appearing from the inner wall of the maxillary prominence. This one is the intermaxillary segment or the primary palate formed by the fusion of median nasal process, and this one is the nasal septum. Then finally, how the paranasal sinuses are formed. So two of the sinuses appear early during the fetal life, that is maxillary and the ethmoidal air sinuses. So they are present before the birth, and the sphenoidal and the frontal appear after the birth. So they form as a diverticular or the outgrowths of the wall of the nasal cavities, and they become pneumatic, that is air filled extensions of the nasal cavity in the adjacent bones. So the maxillary sinuses will develop in the maxillary bone, frontal sinuses in the frontal bone, the sphenoidal in the sphenoidal bone, and ethmoid in the ethmoid bone. So the original openings of these diverticula, they will persist as orifices of the adult sinuses, and the sinuses to complete their growth only till the puberty. So to summarize the development of the nasal cavity, the dorsum, this one is the dorsum, and the tip of the nose, it is contributed by the frontonasal process, mainly by the median nasal prominence. Then the nasal cavity is formed by the fusion of the nasal pits. Then the nasal septum is contributed by the frontonasal process, which includes median nasal process itself. Then the nostrils are formed by the nasal pits. The nasal pits represents the primitive anterior nasal apertures. Then ala and the lateral wall, they are contributed by the lateral nasal process. These are the ala. This will form the lateral nasal, formed by the lateral nasal processes. And the choana is formed by the rupture of the oronasal membrane. Now comes the oral cavity. The oral cavity is made up of two parts: a primitive oral cavity known as stomotium and a definitive oral cavity. Now, this primitive oral cavity, if you remember, is ahead of the precaudal plate, where the ectoderm was in close contact with the endoderm, and there is no intervening mesoderm. So, the primitive oral cavity, it is developing from ectodermal stomotium, and the definitive oral cavity, it develops from the cephalic part of the foregut, which is lined by this buccopharyngeal membrane, which is endodermally lined. Then later on, what happens? The two parts earlier, they are separated, but by the rupture of the buccopharyngeal membrane at around third week of intrauterine life, both the cavities, they will communicate with each other. So now, what are the structures in the oral cavity? The epithelium of the oral part of the tongue, the hard palate, the sides of the mouth, lips, parotid gland, and its duct, Rathke's pouch, from which will be developing the pituitary gland, and the enamel of the teeth, all are derived from the ectoderm. And the epithelium of the pharyngeal part of the tongue, the floor of the mouth, palatoglossal fold, palatopharyngeal fold, soft palate, sublingual gland and ducts, and submandibular gland and ducts are derived from endoderm. So that's all.